Of people in Perth and Peel stood at the end of their driveway at dawn to mark Anzac Day, while other West Australians commemorated the occasion in more traditional ways. I stood at my driveway here in Rockingham. This is now the second year in a row that I and many others West Australians have marked Anzac Day in this way. It reminds us that no matter what gets thrown at us, West Australians will always commemorate Anzac Day. We'll always pay our respects, we'll always have an enormous depth of gratitude to those who served. It demonstrates that no matter what happens, the Anzac spirit will live on. It's the values of the Anzac spirit that we'll need to draw on as we continue to face a serious and emerging situation here in WA. We'll need courage, respect and endurance as we continue to face the threat of the pandemic. Now on to the latest regarding COVID. First of all, I'd like to let everyone know that as of this morning we have no new community cases. We've recorded one additional case in hotel quarantine, which is a returning resident who has travelled back from India. As you know, late yesterday afternoon, WA Health advised the public that one new COVID-19 case had been recorded in the community. That result came after my media conference yesterday and is obviously very concerning. The man in his 40s became unwell on Friday the 23rd of April and presented for a COVID-19 test. The man had previously attended one of the restaurant locations visited by the Victorian man and his friend. That restaurant was the Kitchen Inn in Cardinia. His positive COVID-19 result came back to WA health authorities yesterday. The man is now known as case 986. Case 986 has been working closely with the department's contact tracing team to determine public exposure sites. Case 986 is now in hotel quarantine. We thank him for his cooperation with health authorities and for doing the right thing and getting tested immediately. We wish him a speedy recovery. This new case, transmitted at a restaurant, has resulted in updated health advice for anyone who attended higher risk exposure locations. That is, any of the restaurants the man from Victoria visited, to get tested and complete the full 14-day self-quarantine period as a close contact, regardless of their test result. This is absolutely essential. So I repeat, if you've been to an exposure location that the WA health authorities deem to be higher risk, you must immediately get tested and complete 14 days of self-quarantine, regardless of your result. The list of these high-risk locations and all potential exposure locations are on the wa.gov.au website. I encourage everyone to check this list against their recent movements. If you have attended any of the listed potential exposure locations, get tested immediately. Even if you have not visited one of the locations, if you have symptoms, get tested and self-quarantine until you get your result. I urge everyone who has been in the Perth metropolitan area and Peel region since April 17 to check the list of potential exposure sites on the wa.gov.au website. New potential exposure sites have been added to the wa.gov.au website overnight, including new locations in Joondalup, Alexander Heights, Wangara, Canning Vale, Cardinia, Bentley and Morley. Today, WA health authorities will also add a Landsdale childcare centre to the list. This is Landsdale Early Learning and Enrichment Childcare. Case 986 visited this childcare centre on the 20th, 21st and the 22nd of April. The specific times will be detailed on the wa.gov.au website. WA health authorities are liaising with families that have children at the childcare centre to organise special testing arrangements for both children and parents. More locations will likely be added as our team of contact tracers continue to identify potential exposure locations. The two latest locations include Caltex Woolworths petrol station at Galleria Morley on 21 April between 6:30 and 7:30 p.m. and Woolworths Bentley Plaza on 20 April between 11:15 a.m. and 12:15 p.m. So I remind everyone to please stay alert and check the wa.gov.au website regularly for any new potential exposure locations. Do not be complacent. It's imperative you always follow the public health instructions. The lockdown and the health advice are in place to keep us all safe. I understand times are difficult, but I urge everyone to please be patient and look after each other. Reports so far are that, generally speaking, people are compliant and have been doing the right thing, wearing masks and following the stay-at-home directions. Our WA Police continue to operate 8 vehicle checkpoints, in addition to mobile patrols around Perth and Peel. Since the lockdown came into effect at midnight on Friday night, 8,384 vehicles were stopped at a checkpoint, with a majority having a valid reason or exemption for travel. As of this morning, a total of 287 vehicles did not have a valid reason to leave Perth and Peel and were turned around. We need to crush this virus and stop the spread. Anyone in Perth and Peel right now, or have been in Perth and Peel since April 17, you must stay at home unless you are out for one of the 4 reasons, and when you are out in public, you must wear your face mask. There are currently more than 25 testing locations in Perth and Peel, so attend the one closest to you. All sites and opening hours are listed on the Healthy WA website. So as I said earlier, we have no new local cases of COVID-19 at this point. Overnight, 11,859 tests were carried out across our COVID clinics and private pathology clinics. I'd like to thank everyone who is doing the right thing and going to get tested. This is an extremely good result, but we need to keep it up. We want to see this number increase again today, so please go and get tested. The more people we can get tested, the better. So if you're unwell or you've been to any of the potential exposure locations, please do get a test immediately. I'd like to provide an update on the number of close and casual contacts that have now been identified. The health contact tracers have been working around the clock, assisting the West Australian Police to identify contacts of confirmed cases. I'd like to thank each and every one of them on behalf of West Australians for working so hard to keep us all safe. It's important to note that the close and casual contact numbers will continue to fluctuate as the contact tracing team continues to work through the confirmed cases. WA health authorities have now identified a total of 359 close and casual contacts of the confirmed cases. So far, of the 303 close contacts, 72 have returned a negative result, and of the 56 casual contacts, 13 have returned a negative result. More contacts will likely be identified today, and they will be notified and directed to be tested. Right now, it's too early to predict what will happen come Tuesday. We need to see more testing completed. And most importantly, we need close contacts and casual contacts, that is anyone who has visited the exposure locations during the specific times, to be tested. So please keep doing the right thing. If we all work together, it gives us the best chance to come out of lockdown and safely get back to normal. I'd like to provide an update on our international return travel arrangements. Currently we have 2,166 returned overseas travellers in hotel quarantine. This large number of travellers in our hotel quarantine system is not sustainable. And today we're expecting another 4 international flights into Perth. The high numbers of returned overseas travellers is putting continual strain and pressure on our hotel quarantine system. This is why my request to the Commonwealth Government to reduce the international arrivals cap is vital. If we are to crush the virus, just as we have done before, we need to slow the flow of returning travellers. As you know, I asked the Commonwealth to halve our international arrivals for at least a month. This request has been accepted. However, the reduction in our weekly cap will only begin from Thursday morning. The reduced cap of 512 per week will stay in place until the 30th of May. However, if the Commonwealth is unable to assist with proper quarantine facilities, I am reluctant to return to the full 1,025 per week cap. That weekly number of returning residents is not something, that weekly number of returning residents is not something that can continue long term without proper Commonwealth quarantine facilities being used. I'll discuss this further with the Prime Minister and my state and territory colleagues in coming days. I'll consult with the Chief Health Officer to determine a more appropriate cap number for the longer term. Unfortunately, this pandemic will not be going away this year, and I need to do everything possible to keep our state safe and prevent community transmission. The situation for us right now remains very real. The new case of community transmission identified late yesterday, case 986, highlights just how vital this temporary lockdown is. We need to give our contact tracers the best chance possible at identifying where these positive cases went and who may have been potentially exposed. I'll now hand over to the Health Minister to provide some further information.
Thank you very much, Premier. Can I also acknowledge and pay my respects on Anzac Day, perhaps one of the most important days in Australia's calendar. I joined the many thousands of people who paid tribute this morning, lighting candles in the driveways at dawn. The sacrifices made by our Defence Forces over more than a century put into perspective what we're experiencing this weekend. While we are seeing less movement of people around Perth and Peel, the importance of using the Safe WA app and contact tracing registers has never been higher. We need to expect there could be more cases. If there is, our contact tracing team will swing straight into action. The Safe WA information is crucial for those contact tracing teams to do their jobs. I said yesterday it needs to be a habit. I want to reinforce that message today. Yesterday we had 4,400 scans. This compares to 1,588,779 on Friday and 1,229,386 on Thursday. So, as expected, slightly down on the past couple of days, but it's great to see those numbers maintained high. Total scans are now around 165 million, all important information in the event that our contact tracing teams have to draw upon it. Can I just talk a little bit more about our contact tracing team, because they are doing an amazing job this weekend. This team operates out of the Public Health Emergency Operations Centre, or FEOC, in East Perth. There has been a core group of 50 contact tracers working throughout the pandemic, which has included assisting outbreaks in South Australia and Victoria. The team has now been scaled up in the recent days to over 100 contact tracers. If there is a positive Contact-19 result, FEOC is immediately alerted. The contact tracing teams will contact that person with their result, then work hard from there. They will talk to the person by phone to build up a picture of their life from the time they potentially became infected, where they have been, when they were there, who they had been with. They will use the Safe WA data to help build this crucial picture. Everything is aimed at identifying the risks and shutting it down as quickly as possible. So I want to thank the contact tracing team who have been working throughout the weekend. And can I thank everyone who has been involved in the response thus far. Just briefly to the vaccination clinics, and a final reminder that vaccination clinics are still operating. We have had 87,971 vaccinations to date. And yesterday, 316 people joined that list. We expect to see more numbers start to increase in the coming days, particularly as we open the Perth Airport Clinic and other clinics in the coming days and weeks. So everyone, if you're ready and you're in the cohorts and you have a booking, please take the trouble to get yourself vaccinated. We won't be safe until we're all safe, and vaccination is a vital part of that process. Any questions?
Could you expand a little bit, please, on the inclusion of the Lansdale Childcare Centre? I thought the Premier had linked him to the 40-year-old case 286.
986. Yeah.
Is that the link, or is there something else related to that?
My understanding it is the link through case 986, and I think it was a drop-off or a pick-up. And so obviously, out of an abundance of caution, we want to make sure that we can provide tests for everyone at who have children or staff and parents at that clinic. That clinic opened at 12 p.m. today, and we're expecting around about 200 people to go there, around about 70 families and staff. Now, the reason why we've established a specific clinic there is obviously we'll need to test all those children, so we'll have special paediatric swabbers at that particular clinic, just to make sure that we can give them the maximum convenience, but also make sure that it's done with the maximum amount of comfort.
Did this man work at the childcare centre?
No, it was a drop-off or a pick-up, I understand.
So his children are there?
Family. I don't know if it's direct family or extended.
With the Joondalup Lakeside hotspot, is that linked to this man, the 40-year-old?
Look, you can expect that each of the new exposure sites will probably be linked to new information, so it's likely to be linked with case 986. I don't have those details to confirm that for you.
Is it worrying that we've got about 300 people that still haven't been contacted and deemed close or casual contacts?
Well, we're still in the process of that, and obviously it's a very complex piece of work. The contact tracing teams are moving very swiftly and obviously worked late into the night, and will continue to do that work today. Many of those contacts have now been tested, and we're awaiting their test results, and as the Premier announced, a number of those people have already returned negative results.
So you expect that we are going to get more cases, you mentioned?
Well, look, we just want to make sure that we're doing everything we can to ensure that we're on top of this outbreak. And that means testing and contact tracing and making sure that we isolate anyone who's considered a close contact.
This new case, he contracted it while at the kitchen inn. Do authorities know how close they were sat next to each other, for how long they were sat next to each other?
We don't have those details as yet, but we're pulling the CCTV, and the police, I should just say, are also helping our contact tracing team because they have extra resources as well. So they're working as a team to make sure that we can get as much information as possible.
It obviously must be concerning that the Melbourne man is so highly infectious that he's passing it on to people who are sat at the table which are away.
Yeah, it certainly elevated our concerns, and that's the reason why we have now said people who are at that at those restaurants that previously would have been considered a casual contact have now been considered close contacts. That means that in addition to having themselves tested and isolate, they must isolate for a full 14 days.
Do you know how many people in that restaurant that still need to get their test results back?
I don't have those details.
Do you know if anyone has gone to get tests outside of the regions in relation to some of these exposure sites, Broome or Southwest or anything like that?
We know that our testing clinic at Bunbury's been busy, so we're obviously pleased that people have taken the opportunity to get themselves tested, and that's the usual, flow of events. But obviously, the big testing events are taking place in the metropolitan area. There are queues at our public clinics. Can I just provide further information of private clinics that are quiet as we speak? And they are 21 East Road in Hocking, 310 Selby Street in Osborne Park, 4B Shield Street in Burragoon, the multi-level car park at Crown Perth, and 423 Canning Highway in Melbourne. And we'll list those clinics on the website and other available sites.
People getting tested at Bunbury, are you concerned that some of those people were out and about in the regional communities who left on Friday weren't aware that they should have been locking down since April 17th because that information wasn't really relayed until yesterday?
Well, look, we've seen an elevation in both our vaccination clinics, our testing clinics, and right across the whole system. So I can imagine that anyone in the southwest, they would have received the same instructions as anyone else. If you are feeling unwell, if you are symptomatic, to get yourself tested. This weekend more than any other. So people would potentially be heeding that call.
Some GP clinics down south are concerned that they'd be completely overwhelmed if they have to start really rapid COVID testing. Was it a mistake to allow people to rush out of Perth and down south?
Well, look, as you're aware, on Friday we were in charge of an evolving situation. The fact of the matter is, in order to put in place the legal directions to make those directions enforceable, we had to get the State Solicitor's Office to work very swiftly to put those matters in, those legal instruments in place. That couldn't be done before 12 p.m. and obviously you heard the words of the Premier discouraging people from taking off that evening. But look, we expect people to be doing the right thing, and we know that as Western Australians that they will by and large be doing the right thing.
Was miscommunication area? I mean, that direction wasn't actually put up until last night at about 9 p.m. and signed off by the police commissioner. So
yeah.
Is it just been a massive miscommunication from the government here?
No, we believe that it was appropriate to clarify those directions yesterday to make it abundantly clear.
Did you change the direction? So was it an oversight on Friday? On Friday the advice we were getting was, sure, don't go down. If you are there, when you leave your home, wear a mask. That fundamentally changed yesterday. So what happened?
Well, our other piece of advice was use your common sense, and we expect people to do that. And by and large, people have. We're receiving reports that people are heeding to the appeal to wear masks when they're away down south, and we're pleased that that's the case. But obviously we're working in an evolving situation. We had to move fast and swiftly, and those directions were clarified yesterday.
Is that how a couple of restaurants were included in the whole that total list that shouldn't have been there, and they've now had to be removed from that list? Is that just sloppy work or what?
No, look, when you do contact tracing, you're working with an imperfect information and a load of data, and so that information can evolve. That's why you see potential exposure sites added to the list, and as we get to build up our understanding of the person's movements, where they've gone, how long they've been there, and when they were there, that information tends to change. We try to make sure that that information is as contemporaneous as possible. So sometimes you will see some slight movements.
Premier indicated that it's difficult to know what's going to happen on Tuesday. Can you give us what your insight is to it, including whether the schools will open?
Well, today's insight is that we've had over 11,000 tests taking place over the last 24 hours with just that one result yesterday. That's a very pleasing outcome and will go to some way to providing the Chief Health Officer with confidence in relation to how the advice that he provides the government.
Are you confident that schools can open Tuesday?
Well, look, I'm always confident that our contact tracing teams, the testing that's been undertaken, and indeed the WA public put us in the very best situation possible. And I hope that that situation will come about. But we just have to wait till we receive advice from the Chief Health Officer, and we'll be making that decision as soon as possible tomorrow morning.
Does it make it any more concerning that he had symptoms and he felt sick? Does that make him a higher risk than someone that's asymptomatic?
Sometimes you have people who are asymptomatic but quite infectious. Intuitively, people who are asymptomatic tend not to be as infectious. But I'm not an epidemiologist, so I won't try to get any insights there. But obviously, we've now had the case 986 come to our attention. He obviously caught it from the Kitchen Inn restaurant in Cardinia. That's a concern, and obviously our contact tracing teams are really making sure it's a focus of their inquiries.
Are any of those locations?
Sorry, I'll just finish.
Oh yeah, are any of those locations his workplace?
Not that I'm aware of, but I don't have that insight.
In terms of the hotel management,
No,
Yeah.
in terms of the management of the rooms at the hotel, we started off with the Indian couple.
Sorry, Matthew, Martin, boy, Jackal loves you still!
Start off with the Indian man having the virus before it spread across the hallway.
Awesome, Martin!
To look up to the adjacent room somehow. Does the department take any learnings from this, and will, in hotel management, say in hotel quarantine, if you have a case in one room, people in adjacent rooms?
Look, we take learnings from every part of this pandemic. We've learnt, ever since it came to our attention in late January 2020, we're continuing to learn more about it. We're continuing to change and adapt as those learnings come to mind. We're certainly making sure, as part of our mitigation efforts in the hotels, that we reduce any potential infection risk for those people who are in hotels and are negative. That includes moving them away from rooms where we have infectious guests. It includes making sure that we obviously move the security guards away from those rooms, making sure PPE is worn. But yes, we continue to learn and change and adapt all the time.
Was that the protocol at the time, or is it just the protocol now? Like, why didn't that happen in this instance?
Look, there were some protocols in place, but again, we continue to learn.
So it hadn't got to that stage yet, that wasn't in place for the cure at the time?
Look, I don't have that level of detailed knowledge in terms of how they're utilised. I did speak today with the team from SHIC, and they talked extensively about the measures that they currently use to make sure that they can reduce any cross-infection between rooms.
Can you give any insight into what the trigger point would be for extending the lockdown to the business owners that would be anxious right now about whether they're opening up on Tuesday?
Look, we just have to be cautious. I think that's the message for everyone. We have to be cautious. We're not going to make a move which will elevate the risk to the WA public. Our number one priority is to keep Western Australians safe. So we won't be opening up if we think that there's any potentiality for further outbreak. Premier?
That 2 cases of community transmission, is an extension of lockdown now inevitable?
Well, I'm sure there will be some further measures that continue. What they are, we won't know until tomorrow morning. So we'll get health advice tomorrow morning, but I think people should get used to the prospect that there'll be some further measures continue beyond Monday. What they are exactly at this point in time, we don't have, but we'll work them out over the coming 24 hours.
That's a bit unfair, isn't it? I mean, you're warning people, you're lining them up and telling them something's going to come and hit you, but you won't tell them what it is.
So obviously we've had nearly 12,000 tests today. We've had 12,000 tests yesterday. We'll probably get more tests than that today. That helps us work out exactly what we do. If there's further cases, obviously what we do will be more than perhaps there is now. It all depends upon the circumstances. I can't predict what's going to happen, but I do think there will be an extension of some form of controls. What they are, we'll work out in the morning, and we'll let people know as soon as we can.
So will parents know tomorrow morning?
Again, tomorrow morning, yes. We will let people know as soon as we can what rules are in place. So obviously this has been a debilitating and unfortunate situation, and very regrettable, and we're very sorry that this has occurred across Perth and Peel again. But it is one of those things in the COVID world where things are unpredictable. So we'll do our best to crush the virus over the course of the coming days to ensure we get back to normal as soon as we possibly can.
When it comes to international travel and the caps in place, will you simply refuse to go back up to levels of 1,000 a week if the federal government doesn't come to the party with its own facilities?
We currently have 9 hotels we operate. We're bringing another one online shortly. And by hotels, I'm not talking little motels. I'm talking multi-storey, big city hotels, and they're full of people coming to Australia, thousands and thousands of them. We've had nearly 45,000 people go through them. Running 9 at any one point in time is a risk. And so the Commonwealth has agreed to halve the number of returning Australians into Perth from Thursday. So that takes it down to just a bit over 500 per week. We can't go back up to over 1,000. Obviously the system is put at risk when that occurs. Where the number lands, we'll work out, but we'll advise the Commonwealth that we will not go back up to over 1,000 per week, because our system is put at too much risk when that occurs. And I might say one more thing about that, especially when we learn that many of the people who are COVID positive are people who left Australia recently and went to COVID-laden countries. I'm just not copying that. That people recently went to India and come back COVID positive, and then we have incidents like this occur, and then somehow the Commonwealth says that's okay. It's not okay. It's not okay. If you want to go overseas, it should be for only the most extraordinary of reasons at this point in time. Not to go overseas for a wedding, even to go overseas for a funeral. So we have to be a lot tougher in relation to letting people out of Australia at this point in time.
The government has repeatedly refused to accept your suggestion that defence bases be used at Christmas Island be used. Dutton did it this morning on television. The latest to check that. Why do you keep pushing that? You know they're not going to give in.
It is their responsibility.
Exactly.
Just so you know, it is their responsibility. Section 51 of the Constitution, the highest law in the land, if you like, says it is the Commonwealth's responsibility. So we keep pushing it because it is actually their responsibility, and they do have facilities built for this purpose. I've actually lived in some of these defence facilities. I know what they're like. And many of them were built with this in mind. Christmas Island, when everyone pushes back against Christmas Island, just remember, early on in COVID, the Commonwealth used it. Back in March and April of last year, they used it for people coming back from Japan and China. So all I'd say is, look, it should be a joint effort here. We're happy to assist, we're happy to do our bit, but we've been shouldering, and the states have been shouldering all the load in hotels that were never built for this purpose now for 14 months. The simple reason the Commonwealth doesn't want to do it is because it's risk. It's risk, and it's work, and it's hard, and they can see what happens, or what potentially happens. So they want to push it to the state and blame the states if anything ever goes wrong. It's fair to say it's fair to say the problems have occurred, on a handful of occasions with hundreds of thousands of Australians returning. So the system itself has actually worked relatively well. But when a problem does occur, the impact is then very debilitating, as you can see across Perth and Peel at the moment.
You go to national cabinet, and have you got support from the other states to bring back these exemptions, get rid of these exemptions for weddings and overseas travel?
Well, I've been in communication with one or two premiers. I'm pretty sure everyone will be pretty keen to reduce the number of people leaving Australia during COVID to go to a wedding or an athletics meet, or even to a funeral. And the other point about that is when people say they're going to a funeral, I think the Commonwealth just trusts them. So someone says, I have to go overseas because I'm going to a funeral. I mean, Commonwealth just trusts them and lets them go. This isn't right, and this is causing huge grief. So the fellow in question in the hotel who came back COVID positive, the advice I have is he went to India recently for a wedding. And he's brought back COVID. It spread from one hotel room, through a door, across a corridor, through another door, and infected someone else. That just shouldn't be happening.
On the Commonwealth facilities, the federal government's being dishonest when it says that they're unsuitable to house returning Australians?
I'm saying that they can make it work. They can make it work. As I said, I've lived in some of these places. They might not have one person per room. Maybe they have one person per 3 rooms. But they can make it work, and they can help reduce the load. That's what they're there for.
You mentioned the number of return travellers in our hotel quarantine is about 2,166. What's the capacity?
That's about our full capacity. That's about our full capacity at the moment. So our hotels are full. We've been taking back the highest proportion of returning Australians per capita of any state in Australia. So we've been doing our bit, but clearly the system gets under strain and these problems occur. So we're obviously going to have to reduce the number of people returning, particularly because some of the people returning went overseas recently. If they want to go overseas, if people want to go overseas to COVID infected countries in the middle of a pandemic, well, why should they then come home and risk the rest of us? I don't get it. I don't get why that is allowed.
You're saying that the defence and detention facilities owned by the Commonwealth need to be made available in order for WA to return to its previous cap and all others?
Oh, I'm just saying that we will have to reduce our cap. If the Commonwealth wants more Australians to return, or if they want to let people go overseas and then come back, they should make some of those facilities available.
Are you considering any compensation for businesses that have been forced to close during this lockdown, given jobs?
Yeah, I answered those questions yesterday. Obviously, that's not something we put our mind to at this point in time. We're still trying to deal with the situation we confront. Obviously, it's very debilitating for many businesses out there, but the best thing we can do is get back to normal as quickly as we can. That basically means adopting harsher measures sooner, rather than have this whole issue drag out for a long period of time. what you see in other countries, so for instance, there's lots of people in my electorate here who are from Britain. Their lockdowns and their measures extend for months on end. It's highly debilitating. If we can have this last for days or a week, that's far better than months and months and months of restrictions like happens elsewhere.
Peter Dutton on Insiders today spoke about it being your government's mistake, this outbreak, with reference to the liqueur. What's your response to that?
Well, no. Look, the hotels in question, we put into operation to work cooperatively with the Commonwealth. They're never designed for this. They're never designed to be a secure quarantine facility. It's a bit rich of them now to blame us when we're doing their job.
Just to follow on from Mr. Dutton, the Assistant Defence Minister, Andrew Hastie, I just wanted to get your comments on his comments that talking about Anzac Day. He says the diggers didn't go into lockdown when the bullets started flying.
It's a very strange and unnecessary comparison on Anzac Day, and I'd urge him to think again.
I think he's referring to Australians these days perhaps maybe be softer than the old diggers, and that's what he was trying to get at. You would accept that.
COVID, have a look at what's happening in India or what happened in Britain or the United States. For people over the age of 70 and as you get older, COVID is deadly. It's deadly. It just kills people in large numbers. I mean, I'm not going to apologise for trying to take measures to save people's lives. We're not currently in the First or Second World Wars. We're just trying to save people's lives. And I urge Mr. Hastie to think a little bit before he speaks in the future.
He's suggesting that locking down your decision essentially lacks courage.
Yeah, well, it's look, yeah, Donald Trump's America is not Australia. That's the Donald Trump America attitude. And look what happened there. You know, 500,000 people have died because they refused to take action. I think it's, in these circumstances, you've got to actually lead and you've got to actually take action. You don't just drift along and hope for the best.
Just on the new case, the man in his 40s, he contracted the virus last Sunday. For how many days do you believe he was then infectious for in the community?
Sorry, last Sunday,
The kitchen he contracted it last Sunday.
yes.
And then at what point do authorities believe he became infectious?
I think it was 2 days afterwards. They think it would be around 2 days afterwards he could potentially have been infectious. We have listed every venue we have currently secured that he went to. And urged everyone who went to those venues to get tested as soon as possible. If they're classed as a close contact, which is basically people who went to a restaurant he may have been to, they have to isolate for 14 days. Basically, when you do contact tracing, you meet with someone and you ask them what they did over the course of 4 or 5 days. Sometimes they can't remember everything they did. So then we have to track all their financial records, we have to track their phone, we have to find everywhere that they went. That's why it's a time-consuming process to work those things out, and that's why new venues appear over time, because someone might not remember. For instance, Peter, you might not remember everything you did last week and everywhere you went, and that's why our systems are designed to track it using every means we have at our disposal.
It doesn't appear there's a workplace that's been listed. Do you know what he did for a living? Was he in close contact with
I don't know if he was at work. If he was there, no doubt it will be listed, but I don't know if he's at work or on leave or what it was. I understand he works in finance.
Is it heartwarming to see World War II veterans that are close to their hundreds, coming onto the driveway this morning?
Well, you know, I stood at the end of our driveway and I saw people up the street who were standing there with a candle. It was very good of people to do it in these circumstances. It's the second year in a row we've had to do it. It was good many people did it.
And just to clarify, the testing clinic that's at the childcare centre, that is specifically for parents and kids?
That's it. So it's, I don't think you'd class it as a clinic. I think they've sent some people in there to test the children, the parents and the staff who are at that facility or use that facility.
Is it your understanding that case 986 didn't go in to the childcare facility?
I understand he went there on 3 separate occasions. He's from Lansdale and it's in proximity to wherever he lives. And the 3 occasions, I don't know if he went in or not, but we're not taking any risk.
Do you know what his symptoms were? Because he said he was sick.
Oh, well, the normal symptoms with COVID, I think it can be respiratory, sometimes it can be in your stomach, sometimes it can be nausea. The symptoms can be varied.
All those people who left Perth late Friday or even early to go to holiday hotspots over the long weekend, do they need to get permission to return to Perth and Peel today or tomorrow?
I might get Roger to answer the question, but I think, just hold on a second, maybe at the end, Roger. Pretty sure you can return home. So if you have to return home, I'm pretty sure you can return home. I don't think it enhances the risk for anyone who left Perth to return to Perth. So I think that's, in fact, that is the answer. If you've gone out to the regions and you need to return to Perth, to return to your home, you're permitted to do so. Thank you.
You want to check it?